Hi, everybody. I'm Dr. Kate McLean. I'm a board certified OBGYN, and I'm the Chief Medical Officer here at Evvy. I've been getting lots of questions about Evvy's treatment outcomes. And here's the exciting thing is we actually recently published in the peer-reviewed journal Microorganisms a large study on exactly this. So this study focused specifically on Evvy's BV patients. We looked at over 1,000 patients who had tested with Evvy and been diagnosed with BV, received a full treatment plan on our platform, and then underwent testing again. And what we saw is that over 75% of these BV patients had good symptomatic relief. And this is in keeping with what the published literature tells us to expect with BV-related treatment. But here's where things get really interesting. We all know that the recurrence rate for BV is problematically high. We know it can be as high as 50% even at the 3-month mark. Our patients retested on average at 4.5 months out from their initial diagnosis and treatment. And by that stage, only 30% of our patients had recurred. And this study was conducted prior to the recognition that BV partner treatment is a good idea, prior to Evvy offering BV partner treatment. So even without BV male partner treatment, our recurrence rate is only 30% at an average of 4.5 months out, which is really fantastic. And we think this is due to a number of reasons. So not only do patients feel better, but we could see on their second test how their vaginal microbiome itself had responded to treatment. And we saw a couple of things. First, we saw that BV-related microbes decreased pretty dramatically in response to treatment. So take Prevotella, which is a known culprit of BV. It's known to produce biofilm and make BV more difficult to treat. We saw that on average, Prevotella relative abundance decreased by 54% between test 1 and test 2, which is fantastic. We also, however, saw that Lactobacillus populations increased between test 1 and test 2, and that relative abundance increased on average by 60%, which is extremely robust and encouraging. And we think this is not only because we are really intentional about what antibiotic we prescribe for BV based on the patient's individual vaginal microbiome picture, but we also work really hard to rebuild those healthy lactobacillus populations with the use of vaginal probiotics. We're going to continue to study our patients' outcomes and would love it if you'd follow along with us because our ultimate goal is to improve your patient's health and to improve their symptoms.